prevention. Are people familiar with exposure and response prevention? So I'll just go over it a little bit in detail here. So exposure and response prevention is really the gold standard treatment in controlled trials for the treatment of OCD. And really what we're looking at is we're helping people to actually move towards some of the things that come up, some of those obsessions, some of those fears. And we're practicing together to change the response. And so what that might look like, if the typical response, let's say, to worrying about becoming contaminated is washing hands, we might practice not washing. Or we might practice changing up that ritual a little bit. So extending the amount of time between becoming contaminated and washing our hands, or decreasing the amount of time that's spent washing our hands. And as well, with exposure and response prevention, we're not looking to get rid of the thoughts or the feelings. What we're doing is we're really bringing in how can we learn to live and live a full life with some of these thoughts and feelings. Because really what we know is what keeps us trapped in the cycle of OCD are not actually the fears or the feelings, but it's the responses to these fears and feelings that keep the cycle going. So here we have this little girl sitting with the OCD monster, and actually we talk about really befriending OCD and kind of inviting OCD into the room, and in doing so, learning how to live a full life with OCD and doing what it is that people want to be doing while having these thoughts. So can we be engaging in values-based activities while we're worried? Maybe someone is worried about a contamination fear and they're out to dinner with their partner. So can we have these thoughts, notice that the thoughts are here, check in with, oh, okay, what's coming up in my body with these thoughts? And in this interaction with my partner, how do I want to show up right now? Maybe that means listening to about their day at work. And so our goal here really is to allow some of these things in and practice being with them and responding to the thoughts that come up differently. And I think that just the term exposure can sometimes get a feeling of,